Whenever we process an order for a patient, we want to make sure we're doing it with a compassionate touch, like treating them as their family member.
If you're flying from Los Angeles to New York and you're off just 2 degrees, you don't even end up in New York. I think you end up in like Maryland. So 2 degrees over the course of thousands of miles makes a huge difference. Same in a patient journey. Welcome to another enlightening episode of the Offsite Team Member Podcast, where today we are delving deeper into the intricacies of mapping the customer journey specifically for rehab wheelchair patients, respiratory patients, and durable medical equipment. If you're involved in these fields, this episode is for you, and we'll get into why, because you don't want to get lost in the process of taking great care of your customers. So navigating this journey in these sectors is not just about selling a product, though we do sell lots and lots of products. It's about understanding and addressing the comprehensive needs of individuals who rely on these vital healthcare solutions daily. We're going to explore how accurately mapping this journey can significantly enhance service delivery, boost customer satisfaction, and ultimately lead to higher retention rates and profitability. So today, you'll learn why a well-constructed customer journey map is crucial in these healthcare segments. We'll also discuss how it helps in anticipating customer needs, improves communication, ensures timely follow-up, and personalizes the service experience of every touch point. Mapping the journey allows for a more empathetic approach to customer interactions. We know customers are going to call us at certain times, and we have a general idea of what they're going to be feeling when they call us, email us, instant message us, or come into any of our stores, which is especially important when customers depend on your products for their well-being and quality of life. We are not going to just be vague, but April and I, we're going to discuss actionable strategies and insights that will help you refine your approach, make your operations more customer-centric, and ensure that every customer feels valued and understood from their initial inquiry to ongoing support. And really for us, what this also means is when the money hits our bank account, because we've taken care of them, dispensed the product, billed the insurance, and then receive payment. So it allows our customers and employees to take care of their families as well too. So whether you are looking to improve your customer service, streamline your operations, or just get a deeper understanding of your clients' needs, patients, this episode will equip you with the knowledge and tools to do so effectively. Join us to transform how you engage with your DME clients, rehab clients, respiratory clients on their journey. Hey, how are you today, April?
I'm good and excited. How are you?
You are excited. What did we just buy yesterday?
Our plane ticket going to Yakima.
Yeah, you're coming back for the third time in the United States.
Correct.
You're officially getting frequent flyer miles now, coming over here. Now you get to, you're bringing your husband, which is awesome. Your husband is our CFO's executive assistant who takes care of a lot of our back-end data, analytics, IT work, which is great. So it's just really exciting to have your family come, 30 plus offsite team members that our company employs. Not all of them come here, only a few come to the States, but it's just enough so that way when you're coaching the other offsite team members, it's not just something that we've interacted via Zoom. It's really helpful to come here in person. So I'm really excited that you guys get to come. And yeah, we were talking about before the podcast started, like even, as you land in Seattle, maybe we go to the Museum of Flight and see something fun like that. I want to take you on a ferry so we can kind of see what that looks like. And we can also record a few podcasts in person instead of via Zoom, which is kind of
correct.
So I am going to take you to Olympic National Park when you guys come here. And now I'm going to go way back to the 90s. So I was married in the late 90s. And Olympic National Park is like this amazing park where there's moss, there are these evergreen trees, you name it. And I love to backpack. Now, this is before GPS. So in the late 90s, I'm attempting to hike from the north side of Olympic National Park to the south side. And it was now that I think about it, it was 1999. It was an El Nino year. We had way more rain and snow than we have ever had. It might have been a record year, but if not, it was close. And I'm trying to get from Port Angeles on the north side down through the park. And there's just essentially what happens, I got lost. And the reason why I got lost is you cross a lot of little itty bitty creeks, but when there's all this massive snow runoff, the little creeks looked a lot like rivers. And in the process of reading maps and with my compass, what happens? I went up the wrong mountain. I thought I'm going to go over the mountain pass and I'm hiking. I was in great shape. I went over the wrong mountain. And what happened was, the funny thing, now it's funny. I was supposed to get married a couple days later. And we're stuck in the middle of the wilderness wondering, oh no, am I going to miss my wedding? I'm like, this is not going to be good. And what actually ended up happening is we never did get over the mountains. We actually had to turn around. All my groomsmen, we had to hike out almost like well over, I think it was over 30 miles in less than 24 hours. My groomsmen, it was comical. They were exhausted. But where am I going with this? We didn't have the proper map to get over the mountains when we did because the conditions were rough. It's the exact same thing with our customer journeys. No matter what kind of business that you have, we need to know exactly where are we going, what's the map? Because what happens is now there's this cool app called All Trails. I use it all the time. If I get off the trail, I get a little notification on my phone that says, you might want to look at the map. It looks based on our GPS coordinates, you're off the trail. And several times, because I do a lot of backcountry stuff, you'll miss the trail turnoffs because not a lot of people will do it. And it will just say, hey, please check your map because we think you're lost. And not always, but a lot of times it truly is. I am lost. I look back, but if you catch getting off trail soon, it's really easy to fix. Back in the 90s, I caught way too late that we were lost, and I never did get over the mountains. I did make my wedding in time, thank God, which my wife really appreciates. So today we're going to dial into the customer relationship management, or CRM, if you've ever heard the term CRM. This really is how do we track the process of all of our customers? So before coming to Howard's April or Offsite Team, have you ever heard of the CRM journey or the customer relationship management journey in other businesses?
No, I have not, to be honest.
Yeah. Now we all know it's there, but it's a really important thing to track to see kind of how customers go from literally coming into your store or ordering online to the endpoint of buying whatever widget or product. Now, granted, we focus on rehab wheelchairs, respiratory products, DME, but this can also be applied to any sort of business that anyone runs. So the first thing to look at, we're going to give you some really good actionable steps. We have 7 steps. Number 1 is customer segmentation. So what you're going to want to do in figuring out your digital journey, or if you work with us, we'll do this for you. We'll map your customer journey for you. So not only you're being more efficient in the States, but also our offsite team can help you. But number 1 is to start by segmenting your customers based on demographics, behaviors, and needs. So what this does is this allows for more personalized communication and offering and helps in understanding the unique journey each segment takes. So I'll give you an example. Next week, I'm an ATP. So next week, I'm doing a wheelchair fitting with an ALS patient, which is Lou Gehrig's disease. And what's fascinating, I've worked with enough ALS patients, they will sometimes come walking into our store. And if you know the progression of ALS, they can go from walking into our store, let's say January 1st, to passing away by the end of the year. It's sometimes a very rapidly evolving disease, unfortunately. It's really, really sad. So understanding that customer segment where they come in, it might just be, here is a prescription for a cane, diagnosis ALS. Well, our staff knows if we see that, we're going to not only obviously dispense the cane, but we're going to get our rehab team involved in the process because they're going to also need a manual or walker, a manual wheelchair, a power wheelchair that can also eventually tilt in space. We'll know that that patient will probably be a ventilator patient down the road if they choose that route. So there's a lot of things of understanding that customer segment, and this is the progression of that disease. So that's number 1 in terms of customer segmentation and figuring out what that looks like. So how can we use things like that with our offsite team when we see certain diagnosis codes come across? What are your suggestions, April?
It's actually the same thing as what you mentioned. We collaborate with our other team members. So when we see a diagnosis patient, just a simple blood pressure cuff. So a doctor prescribed that one. When we read the diagnosis, this is a patient with CKD and at the same time diabetes. So we also collaborate with our team members with the offsite team who's handling the documentation for diabetic shoes. Maybe this patient is eligible for one, or we also check with our offsite team member who's working on CGM, the glucose monitor. So
Absolutely.
maybe this patient will be eligible for one. So that's what we do.
Oh.
So we're not just stopping on one equipment, for we know that we can help them even more.
Absolutely. And it's one of those, we understand the progression. And
correct.
so number one is understanding customer segmentation. Number two is understanding touch points identification. So what this would be is identify all potential touch points where customers interact with your brand, whether it's through social media, website, email, direct contact, and understanding these touch points is essential for crafting a cohesive customer experience. Now, because we're in healthcare, we have to be very aware. You can't just post things out. And I like to use the example, not an actual customer, let me preface that, but let's say Michael Jordan were to come into our store and get diapers. Michael Jordan, this is hypothetical, don't turn me in. But some people are very sensitive. They don't want other people to know their stuff. So we hold to HIPAA, and usually we use Brightree and their CRM stuff because it's all HIPAA compliant and encrypted. And so they allow us to touch and reach out to our customers and what that looks like. It's really hard. So if we were just selling some widget that was not HIPAA compliant, we could be way we wouldn't have to worry about it much. We could say, hey, you bought this pen from us last week. Hey, today you might need a paperclip. We can't do that because we're in healthcare. But what it does, you have to figure out touch point wise, what can you talk to the customer about, how frequently? So for example, once a customer's come into your store, there's X amount of time that we can then reach back out to them. But if a customer has not come into our store because of different Medicare rules, and you can't always reach out to all customers and market to them. So there's very specific rules. If you're not sure what those rules are, reach out to us and we'll just kind of let you know, hey, this is what Medicare states in terms of marketing to existing customer segments of the population. So there's customer segmentation, there's touch points, and then there's what's called customer needs assessment. So at each touch point in the process, mapping our customer's journey, we assess what they are seeking, what do they need assistance with, and this step is crucial for ensuring that the CRM system provides relevant information and support to meet those needs effectively. So for example, let's use PAP patients as an example. There's a process. We pretty much know every PAP patient's going to need a new mask every 3 to 6 months. That's just kind of how it is. And we've done it enough where we know what that's going to look like. When do they need new filters? But every product's a little bit different in what that looks like. So give me an example like how we might use that with our PAP process, April, especially with the customer needs assessment.
With the PAP supplies, so what we do is we call them, and we also do backtracking of the orders. So if the prescription is almost at the end of the expiration date, like the validity date.
Yeah, because the scripts are typically only good for 12 months.
Correct. Exactly. So what we do is we contact them, we check with them, see if this is something that they need, and then we'll collaborate with the referrals office or the doctor's office in order for us to obtain that one, and then continue with the process of providing the supplies that they need.
And then once we get that then goes into the fourth component of utilizing your CRM, which is engagement strategies. Every person's different. So what we do with our engagement strategies is we develop different strategies to enhance engagement at each touch point. So each touch point with the patient might be customer walks into the store, customer calls us, they receive a statement in the mail, they receive an encrypted text message or an email, what that looks like. So every engagement with the customer and how we're going to help that customer along the road. So go back to my analogy of getting lost. If you're not intentional with your customers, you very easily can get lost, in the forest. And so we have to be very intentional with what this looks like. And the nice thing is most diagnoses, they're pretty predictable. I can tell you ALS as an example, we know where it's going to start and where it's going to end. Now, how fast it's going to progress, we don't know. Even such things as diabetes, it's like 1/3 of all diabetic patients eventually will have some sort of amputation. Hopefully that never happens. Hopefully they change their behavior. Hopefully they exercise. Hopefully they get diabetic shoes, take insulin if they need it, but most don't. And we just know based on data that this is going to happen.
Mhm.
And so a lot of it's just knowing this and using engagement strategies, and it's going to help produce a seamless experience. And this is the advantage of the offsite team, because it gives us that labor where we can call the patients, we can text message the patients, and we have a heck of a team. Like you alluded to, some focus on CRMs, not CRMs, let's just call it PAP. We have a PAP journey. We have a diabetic journey. We have a rehab journey. We know what that is. The fifth step is feedback and adjustment. So now what we're going to do at this phase is we're going to implement mechanisms for collecting feedback at various stages. So this is where someone calls in and says, hey, what is going on with the process? And what happens frequently is we're trying to get a wheelchair covered, as an example, or we're trying to get a PAP covered and we have not heard back from the insurance company. So we have a proven process in place because we don't want to lose that patient, because if they get frustrated with us, they call our competitor down the road. And every time that happens here, we've done most of the work and then they get frustrated. And so you've got to have feedback and adjustment. And it's one of those things I frequently use the analogy. If you're flying from Los Angeles to New York and you're off just 2 degrees, you don't even end up in New York. I think you end up in like Maryland. So 2 degrees over the course of thousands of miles makes a huge difference. Same in a patient journey. And so we use CRM. We use Brightree as well as a couple other softwares to really track and map our customer engagement process. Now, the sixth step is analytics and optimization. So what this truly is we're now going to track customer behaviors and journey success. So by doing this, it allows us to analyze data such as a conversion rate, engagement levels, customer satisfaction scores to help optimize the digital journey. So this is hard. It's not like we're trying to manipulate our customers. What we want to do is allow customers who come into our store to go out of our store with, let's say, a walker so they can go to their grandkids' soccer game. That's really what it is. But if it gets stuck in the process, maybe they then can't get that walker and they might fall down. They can't get out, or heaven forbid, they then fall down, break their hip, go to the nursing home. And it's not good for especially our customers or what happens in the future. So this is the analytics and optimization side of things, of understanding the CRM process. What have you noticed the process as we work on, let's say, diabetic shoes or PAP resupply or rehab satisfaction scores?
What I like about that is when we send out those, it's not like we're trying to fish the score from the customer. We wanted to get the information with the unmet expectation, the unmet needs. What are the pain points? That way we can streamline and change the procedure, the process that we do in order to have a satisfaction with our patient. We want to make sure that it is being met. So that's basically what I like about that.
And in a great scenario, even PAP patients of ours, they become some of our best proponents, because literally we have had so many patients. We all know them. They haven't had a good night's sleep in 5 years. They literally go home their very first night on PAP and they sleep thoroughly. They dream. I've had people say, Erik, this was the first time I've been able to dream and remember my dream in years. I feel like a new person. I'm like, well, you finally slept and didn't die while you were sleeping. But understanding what that looks like. And then, so a lot of times it's not like we're calling to sell. We're just calling to remind them on the phone and saying, hey, do you want a new mask? Because masks break down, filters get dirty, nebulizers need to be replaced so we're not breathing in cooties. So in understanding what the analytics and optimization are. Now, also by understanding these numbers, it will also help you as your store grows when you're off path. So when I was hiking, I was off path and I did not realize I was off path until literally I climbed up a mountain. And I was like, oh, crumb, I'm on the wrong mountain. There was nothing I can do because I got all the way up. And by the time I was above the tree line, I was like, uh-oh, I'm at the wrong place. And this is what proper analytics and optimization do. I've had a lot of people, I wish this never happened. We hire someone, we think we're doing everything right. We train them perfectly. They say all the right answers, and you don't realize it until you look at their numbers. I'm like, why is their error rate so high? Or why is their conversion rate so low? Well, that just tells you something's off. And so this is the advantage of KPIs. If you don't know KPIs, go back and listen to that episode. Just understanding what's a proper KPI per team member. It's really nice to look at the different analytics and optimization. So other stores, when they're looking at their numbers, what are a few things they should be looking for, April?
They should be looking at the profitability and
Profitability per customer, profitability per
Mhm.
hour.
per customer per hour. They also need to check the retention rate through customer satisfaction. They have to add that one. They also have to check new patient acquisition, the marketing, if they're doing a good job with the customer, word of the mouth can be very helpful with the company. So that can
Or really
help acquire.
hurtful as well, too. Helpful
Yes.
or hurtful. Like, oh no, what did you just say
Exactly.
about us? And it's hard. We were checking our Google reviews. I don't think I've shared this with you yet. Just like 2 days ago, we got a 1-star Google review, and I was reading
Oh,
it,
we
and it's
do.
just like, it says 1 star. They were very helpful and met everything, called, and took care of us every step of the way. And I'm looking at this Google review going, oh, I think they thought 1 star was like good, because like
Right.
literally everything they wrote was great, but sometimes things just aren't connected. Typically it's like, Howard's forced us to pay our deductible. Well, I can't help you with that. That's on your
Right.
insurance company. And sometimes you will get 1-2 star reviews, and I
Mhm.
can't do anything about that. We need to get paid for what we do. But the last step of the CRM process is integration and automation. So this is really where we cannot do manually, even with offsite team members, everything. There's
Mhm.
got to be integration in all aspects. And what can we automate? So this is where, because we use Brightree, they have their portal, and that's nice. Where if I love these customers, they go in, they log into their account, they hit whatever check boxes, and bam, the item sends their PAP supplies directly to them. So those are automations, because every touch point costs money.
Mhm.
It gets really, really expensive when you understand labor. So a good CRM integrates this really, really smoothly. And what it does is, the more that we can automate as a business, such as data entry, follow-ups, and even certain customer interactions, what it can do is it can significantly enhance efficiency, consistency throughout the entire customer journey. So just understanding integration and automation will save lots and lots of money, but it'll make that customer happier along the way. I love it
Mhm.
when there are a few things that I buy online. They're like, hey, do you need dog food again? Yes, I need dog food every month for my dogs. Now, unfortunately, I wish we could just have something on file and say, hey, send me my CPAP mask every 3 months. Medicare does not allow for that to happen. If you do it, you open the risk of we have to check off a few check marks along the way.
Mhm.
The person truly does need that. So this is where it's a little bit harder in healthcare, understanding integration and automation. We have to know what the rules are. There are businesses out there that abuse it, and frankly, they're breaking the law. We don't do that, nor we condone it. So it's one of those things we have to be aware
Mhm.
of it. We all know those companies, they eventually do go out of business, because sometimes those patients die. And we've had those
Right.
patients, we walk into their apartment, we're like, there are literally 20 boxes of diapers. Well, you have to
Mhm.
literally sign off that, you need new diapers. So that person was either lying, or our competitor was randomly just drop shipping supplies, and that's against the law. So understanding what integration
Mhm.
and automation looks like. So how can the offsite team help in this whole CRM process, April?
Being able to provide customer satisfaction is what the offsite team helps, number one. And just being very keen with the details. So whenever we process an order for a patient, we want to make sure we're doing it with a compassionate touch. How can we help the patient? Like treating them as their family member. So that's what the offsite team members does. We do trainings, extensive trainings. We do refresher trainings to make sure that we are up to date with the process in order to meet the insurance guidelines. So that's our goal, because we don't want to have denials by the end of it, like helping
Yeah.
and then not getting paid. So that's what the outside team does.
And it's great, and they work their tails off. The number of
Mm-hmm.
times that I know, I was surprised when some of our offsite team members were doing phone calls. They are actively like, hey, what they'll do is like, hey, do you mind if I phrase the phone call this way? And usually I say yes, because their
Mm-hmm.
goal is, we think this will really benefit our customer. And
Correct.
more often than not, it's correct. And when we do, then we release that mode of training to the rest of our team of what this looks like. So it's one of those things, you get an offsite team member helping you increase sales, by whatever CRS system that you're using. But also what happens in the process is, as the saying goes, is iron sharpens iron. Our team is sharpening your team and vice versa, because we all want to sell more, which really is just to take really great care of our customers, as long as it's something that the customer needs and wants. So, hey, if you have questions about, hey, what's the CRM process for your business, we'd be more than happy to help, whether it be the rehab process, the respiratory process, from a sales lead to dispensing to billing. We are here to help, or just any other DME item. So, hey, reach out to us on offsiteteammember.com, and April and I, we are here to help. So until next week, we will see you then.